It'll be okay.
No.
Drink some water, go for a walk, and don't forget to eat.
Learning to live with discomfort.
Yeah.
Like, you're gonna be uncomfortable, but the end result is gonna be you're fine. Like, you're gonna get there, you're gonna be uncomfortable, and you might be uncomfortable for a long time. You might be uncomfortable for 6 weeks because you can't poop.
And it just happens sometimes.
You might look 9 months pregnant when you're really not. I mean, that's actually a sign of serious issues, so definitely go see a doctor if that happens.
Yes, please.
I was ignoring it because I think I was scared to go see a doctor because I was afraid of what they were going to tell me. Websites say if you are bloated for 7 days straight or you do not have a bowel movement for 7 days straight, go see a doctor. Go. It's an emergency. Eventually I was like, I need to go see a doctor because I legitimately want to die. I'm in so much pain. Nothing fits. And I'm carrying, triplets in my stomach. I'm so big. I don't think I actually was that big.
No, but it feels like it in the moment.
I literally woke up one day with a stomach out to here. This is not normal. I feel huge. It was like rock hard. It was horrible.
Yeah, you definitely needed to go get that checked out.
And I'm glad I did.
That was a big warning flag, like from your body, like, help me.
Never ignore signs. Go see a doctor. Yeah, there's something about just letting yourself be uncomfortable. And just like sitting in your discomfort and not wallowing in it, but just like processing what is happening to me. This is happening. I'm going to be okay. It might happen again, but I have to be uncomfortable for the time being.
It's good to acknowledge the discomfort, realize it's going to be okay, but 3, make sure you take action and go see a physician when it's appropriate. It's a fine line to toe. It sucks, I'm gonna die. No, there's an in-between, folks.
I would just put like my life on hold because I'm bloated and fat and gross and I feel like crap. And it's like, keep doing the things that make you happy, because even though you're not happy about yourself physically right now, you can still be happy. It's okay. And I think a lot of people who are like in recovery, they feel like they're not supposed to be happy in the first place. So then when they get bloated and they get miserable, they're like self-fulfilling prophecy. Well, like, I'm supposed to be miserable now.
I don't deserve to be happy right now because I don't look nice. I don't look fill in the blank.
There were so many times where it's like, I just didn't want to go to work. And I decided that I was going to recover. No matter what, I'm going to work. I don't care how I feel. I can't care how I feel about myself physically because this is deeper than that. And I'm not going to hide from the world because I think I'm fat.
It's go time. Like, it's time to put the pedal to the metal and get out there and take care of yourself in different ways, like whether it's emotionally, and sometimes that means get out of your own head. Like for myself, I feel crappy. I have to go to work because I have patients relying on me. I don't have time to sit and wallow in this.
Right.
So I'm going to go to work. I'm going to be uncomfortable, but I'm going to get out of my own head. I'm going to go take care of other people.
But sometimes you have to give yourself a little bit of self-tough love.
Yes.
Like you have to be, you have to be tough on yourself sometimes and be like, okay, so the outfit you were planning to wear, you can't wear now because you're bloated. Or wear that outfit and be like, yep, I'm bloated in it. So what?
And I still look cute.
And I still look cute. Yeah.
Gosh darn it.
And people will still compliment you and be like, hey, you look really skinny. And you're just like,
well, thank you. I look fabulous. I'm always fabulous.
I've definitely learned over the past few years, being told you look skinny is like one of the worst things. Like people think it's such a compliment. It's not. Especially when it's people who know why I don't like hearing things like that. Society says that's a good thing to say. Like people like to hear that. And it's like, no matter how much I'm like, hey, I really don't like being told that I look skinny or that I've lost weight. Like, it makes me really upset. I'm aware. I know. And I'm not happy about it.
You're probably more aware than the average person.
You're enforcing something in my brain because now my brain is saying, They think you look skinny. They're complimenting you. That's a good thing. You want to stay that way. You want to keep getting those compliments. But at the same time, it's like, no, because I'm trying to be healthy. And I know that if I do that, I'm going to be unhealthy. And I don't want to do that. Moral of the story is, even if you are bloated, wear the cute outfit.
Absolutely. And rock it. You're going to look great.
It kind of is a slap in the face to your eating disorder. If it says do A, you do B. It says you're fat in that outfit, you wear that outfit. And this isn't to say you wear the outfit and you're magically super confident. No, you're probably going to be really self-conscious.
You're not healed. You're not magically healed just because you wear an outfit. No, that's not how this works.
It's a subtle like jab at getting that, like at the eating disorder and at your negative mental view of yourself. If you have a negative view of yourself, it's okay to kind of like beat down that negative view of yourself, because the more you push it down, the more the true you is built up.
It's giving that negative talk back and build yourself up. Be like, you know what? No, you're wrong. You need to go away. I don't like you.
Body image is both a mental thing and a physical thing.
It's a big mental thing.
I don't know if you've ever experienced this. I feel like most women have. I think most men have too. Comparison with strangers who have no bearing on your life.
I'm like, Marie, why do you do this? I've recently found some really great Instagram accounts where they will dissect how to do these different poses, like hacks. Here, this is how to make your booty look larger. This is how you fake this. I'm like, people spend time on this? Modeling is your job. If this is what you do, then of course, you would want to learn those tips and tricks of the trade to accentuate long legs and make your booty look better. Like, yes, of course. But to spend that much time trying to get myself to look like somebody else for a image that lasts 1 second and then the rest of the day beat myself down for not looking like that picture I just took, that's not good for anyone. Like, oh my goodness. No, people. I'm like, you are unique and unrepeatable in your own skin, honey, and you are beautiful. So just stop it.
You've probably seen this. It's where the girl hikes up her bikini. Yes. Well, it's the way the bikini is cut, the bikini bottom, and the way she's standing, and the hike up pulls the stomach upward, and it also accentuates the butt curvature. Doesn't mean she actually has a big butt. No. It's just that it makes it look curved because of the way the bikini line is curved. And it's like, people, how are people not catching on to this? But it's an illusion. It's all an illusion. Yeah. And it is sad that people are still buying into it. And it's the same people who think saying you look skinny is a compliment. So I woke up super bloated. I have a bloated outfit that I wear, like an outfit that I'll wear if I'm not feeling super comfortable. And ironically, it's a high-waisted, like tight skirt with tights and a tucked-in shirt. You would think, oh, that would like exaggerate the bloat, but the way anyway,
it's cut.
The way it's cut, and you know, I used to do the shirt untucked. And I found that does make you look wider, but if you tuck it in, it makes you have a waist. And I'm like, so smart. I should know this given my background.
Wait, it's like you have a degree in this.
So then I ended up working with a client, and she comes in and she just kept staring at my belly. Like, she would look at me, but then she would like look down. And it was like, I was like starting to get really self-conscious. I started to have those like dysmorphic conversations with myself, like, okay, she can see my bloat, she's judging me, she's really like, she's slim, she's skinny, she's cute, like, she's better than me, like, all, like, you go from like 0 to 100 like real quick.
It's really annoying.
Yeah, and it was like, it was really like tough, but it was really hard to like pull myself out and just focus on, you know, working with her, you know, doing my job. It turns out that she was on her period. She was really bloated. It was kind of a unaware thing that she was doing, because later on, when I was working with her, she kept touching like her stomach.
Yeah, because she was self-conscious.
She was self-conscious, and then she, like, as soon as she said something about like her being feeling really bloated, she stopped looking at my stomach. And I don't know why she was staring at my stomach. Maybe it was just because of her own like insecurity in her own stomach. And I'm like,
we have weird tics, man.
Yeah, and it made me start thinking about like, how often do I compare myself or judge somebody based on how I feel about my own body?
We want something, like, for example, if someone wants a Beyonce booty, or if they want a nice tight, flat tummy, you start looking at examples of that around you. So whether you're in the grocery store or you're at the mall or something, and you start honing in on this and realize like, well, that person has it, that person has it, that person has it. And before you know it, you're staring at somebody's butt. Now, if you're a physical therapist, you just analyze how people walk all the time. So you're staring at people. You're not checking them out. It's a professional detrimental habit of staring at people creepily while they walk. Like you said, she might have reflected or imposed what she wanted. Like, oh, the person who's helping me, she's so cute and tiny and skinny, and she has this cute little waist and this cute little skirt. Why can't I feel like that today?
Just because that was like her, first day of her period, and she felt crappy. I mean, I have clients, they like look at me and they're like, what would look good on me? And so I have to like stare at their body and I have to analyze it, and I have to I'm staring at them. Some of them are naked, some of them are they're in their underwear, and I have to like look at their form and be like, let's try this, because like sometimes it's really easy to look at someone and be like, oh, this would look amazing on you. Or they might have a shape that I've never worked with before. And I don't want to say that, because if I see it, they're probably already aware of it. I don't want to hone in on like an insecurity. It's my job to build these girls up, and make them feel beautiful. So I've had people recently, I've had some apologize to me because of their body shape. I've got a store full of gowns.
I'm going to find something for you. It's going to be okay.
You came in here wearing clothes, did you not? That means you found clothes for yourself. Yeah. That means that if you can do it, I can do it. I got something for you. As they're undressing, apologize, try to cover themselves, which I get it. They're getting naked in front of a stranger. You don't need to apologize to me. You're okay. You look amazing. It's okay, and it's sometimes I leave appointments my heart is breaking
because they're coming to you for this special dress for their special day, and they're just beating on themselves. You're like, honey, calm down. It's gonna be so right.
Quite interesting that this is the line of work that I'm in.
Yeah, it is.
Because the number one topic that is discussed is weight loss at my job, because everyone wants to lose weight before their wedding day. I have met some really awesome ones who want to gain weight. You can just see people's minds blowing up because they cannot fathom that someone would want to gain weight. But the number one thing is always, oh, I'm going to lose 10 pounds. And this is coming from girls who, if they lose 10 pounds, they'll be nothing. It's really hard for me to hear that, not because it affects me on with my own disordered way of looking at it. It scares me for them, because it's you don't want to do that, because I know in order for you to lose weight, you're going to have to do some really drastic things that are not good.
Weight loss stories can be inspirational. They can be good if someone needs to do it from a medical perspective. But one thing I read before was it takes courage to stop the weight loss. It takes courage to look at yourself and be like, you know what? I've met my goal because of whatever medical necessity, I like diabetes or heart disease, whatever, from a medical professional standpoint. You've done that. You've met the goal. Good. You're healthy. It's okay to stop now. It's okay to eat and fuel your body because you're good.
But no one ever talks about when do you stop, and no one teaches you maintenance.
Yeah, exactly. And that is a big problem right now.
When I have clients who I'll be measuring them.
Yeah.
And they're and I'm just, please keep in mind, I'm a little bloated today. I'm I just saw you in your underwear. Where was the bloat? Okay. Where was it? Because I didn't see any, but okay. They're can you squeeze, when I'm measuring, can you squeeze it a little bit? I'm no.
Because it's not going to fit right then.
And I am guilty of this, where I almost feel I need to apologize. The one girl, she's apologizing for her body, but sometimes I feel I need to apologize for my bloat.
Where do we get these ideas?
Yeah. It's I just don't look good enough today. Oh, it's because I'm bloated. Who, pardon my language, fucking cares?
Who does care? Only you care.
Only you care. And why do you care? There's no reason to care. I posted a picture the other day, and I'm literally typing out a caption apologizing for the way I look in my own photo. I had to stop myself, select the whole thing, and delete the entire caption, and then just put something else in and just post it. And people loved it, and no one knows that I'm bloated in that photo. It could be a photo where you don't even see my body. And I'm I'm so sorry, I'm bloated. It's no one can see it. And even if they could, they're probably not going to care. The only person who cares is you. Who are you apologizing to? Why? What is the point?
At that point, you're like, you know what? I'm sorry, self, for beating up on you and being bloated. Body, you keep doing what you gotta do.
Yeah.
We're gonna be a team today.
Yeah, the only person you really should be apologizing to is yourself because you're treating yourself like crap.
Why would you do that? You don't do that to your best friend.
Right.
You don't do that to your partner in life, whoever that partner is. You don't say, wow, you look like crap today. Excuse you.
Why would you wake up, look in the mirror, and be like, well, I look like shit. Looking all bloated. It's like, no, okay, you wake up and you're like, okay, don't feel good today. Let's move on with the day. Mentally, the best thing you can do is just be like, okay, this is how I feel. Doesn't have to affect my day. It doesn't have to. Changes nothing.
Acknowledge it. It's real. It's there.
Mm-hmm.
We have more to our day than this moment.
Exactly.
Mm-hmm.
All right, moving right along.